man, you see it. Yes. She knows I'm all about my mushrooms, you know, especially that reishi.
Yeah, I know your mother loves flowers.
I do. She does.
So, and there's also a gift card for you for Whole Foods, because we know you like the Whole Foods. You know, so
what's up,
from the Lupie Chix TV, we want to
I appreciate this. I'm going to give this to my mom. Because this is all about lupus, man. See, they pull up, they bring flowers, bring your boy drinks and shit. Sickle cell, cancer, Crohn's.
Yes.
Y'all treat a bro better, okay? Lupus know how to treat company.
Hey, man.
Thank you. Give us a love. Thank you.
To all my Lupie Chix. Lupus matters, lupus matters. To all my Lupie Chix. Lupus matters, yeah. To all my Lupie Chix. Lupus matters, lupus matters. To all my Lupie Chix. Lupus matters. If you know me, I'm a Lupie. I scream in.
Hi, my name is Monica Ellis, and this is Keisha Robinson, and we are Two Lupie Chix. We are here in Midtown with Dr. Rasean Hodge.
Yes. Hey everybody, I'm Doc Hodge. I'm the medical director here at Premier Chronic Pain Care. Nice to meet everyone, and I'm with the dopest two Lupies in the city, you know?
That's right.
Yeah.
Today we're going to interview him, get in his head, you know, and because we need to know, as Lupies, as people with cancer,
diabetes, chronic pain,
any chronic pain,
any autoimmune disorder. Everyone, it's sickle cell month, September. Y'all know what it is. Come on.
So let's get into his head right now. Dr. Rasean Hodge.
Yeah.
All right. So tell us a little bit about yourself, what you do at the pain clinic.
Well, I do the medicinal cannabis recommendations here. Since 2015, Georgia has been legal. And if you don't know, I had a catastrophic neck injury in 2012 where I fractured my neck. So in this very clinic where we're sitting, I wrote a lot of opioids and benzos and muscle relaxers for chronic pain because that was the gold standard. Even though I saw patients had to come back every month, it poorly addressed, it never fixed their pain, but it controlled their pain. So that's been the gold standard, and then suddenly I'm a patient. And once I became a patient, I learned how poorly opioids worked. I learned how poorly benzos worked. Just like lupus, anyone with a chronic condition, my pain was chronic. There was no feel better for me. I hurt every second of my life, and then I had to get the opioids like you have at an earlier age. I've been judged like you have, from the pharmacist to the techs. I have been made feeling small by the physicians, by my neurologists. They're saying, hey, you survived with, you're not paralyzed, and I just felt the lack of empathy, which really makes you feel alone. Yes. And I said, hey man, I'm struggling. And, there was 23 states that had a medicinal cannabis program in the time of 2012, 2013. I said, hey, I think some of these states have figured out the answer to chronic pain. Yes. And that's cannabis. I had no use of cannabis in my teenage and my adolescence. I went to school in Morehouse, so I was around it.
Yes.
But I didn't use it because I believe what the government had told me. Cannabis was a Schedule I drug, so I was, the body it's our temple. I grew up like that, and then I grew up, watching aunts, uncles. I seen what cannabis and drugs, sentences, losing your lives, prison. Now you're a felon, so there was fear, so I didn't touch it.
Well, that's good.
A lot of black people touches it.
I didn't touch it. I had my first solo. I mean, I'm not like lame, but
you're not lying.
But I had my first solo cup when I was 21.
Really?
Yeah. That's why I really didn't mess with alcohol. I really didn't mess. I didn't have to.
And what better person to do this than you that didn't come from the cannabis and now you're working with it and helping other people?
Yeah, that's the blessing in my injury. I was writing these opioids. I was, a sales agent for Big Pharma. I don't know that, most doctors are, until you get injured. And once you're injured, you might have to lean on big pharma, but most of us practice, but we don't practice what we preach. A lot of the doctors that I was seeing, they're not taking the opioids, they're not taking Ambien,
Exactly.
so you don't understand half-life, you don't understand tolerance, you don't understand drug dependency. And I suffer from all three, like anyone that takes benzos and Ambien. One pill won't last 4 hours after 3 days. It'll last maybe 2 hours, and you need more, but your doctor doesn't understand that.
Yeah.
Or the feds don't understand that. And the doctors want to help us, but their hands are tied. They don't want to. They know we need more. They know 4 needs 6 and maybe 8. And there's dangers to that, Now you got to pick up Narcan for it, and that's all very belittling, and we all know. So so now I developed empathy. I now can practice medicine and tell you, hey, this is what I put in my body. Maybe this will work for you. So that's called empirical evidence. And that's what, when we become doctors, they want you to first do no harm and to practice medicine off empirical evidence. But none of us do, because if I'm an oncologist, I'm going to recommend chemo or radiation, but I haven't been hooked up to the chemo, and I haven't been to the radiation, so you just don't really know.
Right.
And now I feel like I'm a dope ass doctor now.
You
Yeah.
are.
Yeah.
You are. Yes.
Yeah,
The accolades.
I feel good now.
Yes.
I feel good about it. I feel
Oh,
good
wow,
that
that's
I'm practicing medicine how it should be. It should be an art. It should be comprehensive. I saw that medicine in this country is not comprehensive. You got to have a disease. It should be preventative, one. But if you have lupus, like you ladies suffer from lupus, it's not like you go to the doctor and say, hey man, try these immunomodulators or try these chemo drugs. You should say, wow, okay, she has a chronic disease. What's her support system like? What's her village like? How many kids? Okay, how can she effectively be a mom? That's an important job for her to be a mom. This chronic disease is going to affect kids. Okay, let me ascertain that, and okay, let me help you with diet. These are the foods that are going to compromise and make your disease or flare-ups more frequent. Okay, then I'm talking about sleep hygiene.
Where you been all my life? I had to cut you off. Where you been all my life? Because no doctor. We been thinking the same thing when I sit in there like, okay, I didn't know tomatoes flare me up. I love tomatoes. You don't know what does, so then you have to be your own advocate. You have to start Googling and YouTube and stuff. And we need more people like you. So
Exactly. I'm literally in tears over here because, like I said, no doctor has ever said anything about exercise, eating right, sleep. Never.
Super
They say, oh, you
important
can't sleep. Let me give you
some
Ambien
Ambien or something or some
Right.
muscle
Right.
relaxers or
Right.
something to help you sleep. So
So
that's great.
we can, and then in turn, what I was so desperately needing, I had to find my own like you did. So now we don't have to have anyone suffering or feel lost like that. We can say, hey man, comprehensive, and then we can heal your soul too with this herb. People with chronic conditions, it will deteriorate your. Everyone's got to believe in something, but people with chronic pain, chronic conditions, that can kind of deteriorate your relationship. With God, because it's pity and why me and
Wow.
I'm a good person.
Look, I'm a good person.
That piece of shit's over there.
He's doing good. I'm over here to suffer. Yes, we all been through it.
Yeah, and then especially when you go for a procedure or you see a doctor and he like, when everyone goes to the doctor knows you're supposed to come out feeling better. So when you go have a surgery, you under for 6 hours, 8 hours, and you do 5 months of rehab, and your pain is like a little bit better, or it comes back. That shit will break you. It's like, man, I laid down. You said I was supposed to be
6
good.
hours.
No,
Like,
Here I am
oh,
still
yeah. So
Wow.
that will compound your pain because and then chronic pain. It's not just that. We all have emotional trauma, childhood trauma. This is all comprehensive care. So depending on your upbringing and all those traumas and scars, that depends on how well you can deal with extra shit.
Yeah.
You see what I'm saying?
Yes.
So that doctor or caregiver or shaman needs to ascertain, again, your village, your past, a lot of history, your diet, sleep, what's your relationship with God, you know, and then I come out with a good game plan for most of my patients, and death is inevitable. The death is going to be happy, which I'm big on, or your quality of life has been improved, which I'm big on, and not just for the patient, for the caregivers as well, because there's a lot of conditions where the caregivers suffer more than the patient.
You are on point, dude, because nobody
I've seen
ever
it.
talks about the caregiver.
Yeah, I've seen it.
Nobody talks about
Yeah.
caregivers. So
Caregivers
do you actually think do doctors need more training or they need more compassion?
Empathy.
training for sure, and you know, the research is astounding. You know, with once cannabis is off the Schedule 1 drug list, it becomes a Schedule 2 or a Schedule 4 or a Schedule 5. Then there'll be a ton of research. So they're studying now. You know, just out of the University of South Carolina, our neighbor of Georgia, South Carolina. Those researchers are studying cannabis and COVID, and I'm talking with the respiratory inflammation and SARS, the distress, and they believe, and the studies are showing that cannabis is great for COVID.
Wow.
Yeah,
Tell us more. What do
Yeah.
you know about it?
Yeah, that's
And
universal.
also tell us about Schedule 1s and 2s, because I don't know what that is. Like, what
Okay.
is
I do,
Schedule 1
but for the
and
people who
Yeah. So, and let me mind you,
Mhm.
this war on drugs was racist. It's deep. So you think around the 1890, 1900, that was the Mexican-American War. So that time, you know, cannabis was prescribed here, all around the world, but it was in the form of tinctures
Oh, okay.
and hashish. So that was in the Western world, that's how we consume, that's how doctors prescribed it, in tinctures in the form of hashish. But around the 1890, 1900, the Mexican-American War, we had Mexico and Mexicans, they inhaled it. So that was kind of foreign to how to medicate like that. And then we kind of used like, hey man, you know, they're gonna bring all, it was pretty much to stop them from coming into this country. And that's why I don't call it marijuana, I call it cannabis, because that has racial undertones, because that's how Mexicans pronounced it. And they put a negative stigma. So that was the beginning of regulation. So fast forward, you know, you had guys like Anslinger, who was horrible. He was like the narco head for this country, and he was very paranoid, and he didn't like blacks, Jews, women. He wanted to keep it real old school. He really passed tough cannabis laws, put a tax on it, and then he put it on the controlled substance list. To answer your question, he made recommendations to put cannabis up there with heroin, opioids.
And it's from the earth.
So that's what I was saying.
Come on.
Yeah, but that was to control. Prisons were private. You know, blacks haven't grown in this country since we've been here. We're only 13% of this population since slavery. Stuff to just keep us. So anyway, a Schedule 1 drug means that drug or substance has no benefit to your body, and 2, that doctors can't safely subscribe it. So cannabis is up there with cocaine, which again was everywhere. Docs prescribe cocaine, marijuana, and opium all day, every day.
Wow.
Even alcohol, but cannabis gets regulated. That's what Schedule 1 drug means, that there's no harm, there's no benefit to our body, and docs can't really safely administer it. So that's what a Schedule 1 drug means. Now, and also it's highly addictive. And so Schedule 2 means it's moderately addictive. Schedule 3, obviously, you know, there's no addiction. Schedule 4,
So
Schedule 5.
Schedule is the
higher levels of addiction can happen.
Oh, wow.
So we'll see in the next year or two a lot of Schedule I drugs, not just cannabis, LSD, MDMA. You heard of ecstasy?
Mm-hmm.
You might have taken some ecstasy. You look like
I
haven't.
you look
No,
like,
not yet. I haven't took that.
So we're studying these drugs that were used to be medications mainstay before the IV needle came out. You know, once the IV needle came out, a lot of the herbs we used and prescribed as physicians was out the window because you couldn't mass produce it. I can take aspirin and if it's water soluble, I can make it. I can batch the hell out of it, and for $10 serve 1 million people versus growing a plant, paying out all this money. You're gonna have a different effect, and you're gonna have a different effect, and that kind of made cannabis not the mainstay of treatment. You know?
It should be.
Yeah, it's coming back.
We have that endocannabinoid system.
Absolutely.
Right.
Yeah, we've been studying.
Yeah, that's great.
We have that, and the CBD and cannabis, all that helps that.
Yeah.
We're supposed to get it.
Yeah, we are. The ECS is very important. You know, when organs work together, that's called a system. So, you know, they lied to us and emphasized cardiovascular system because heart disease is the #1 killer around the world. Huge business. You're gonna die from it regardless. So I can put you on pills for 40 years, make a lot of money. I can put stents in you, make a lot of money. People survive heart attacks, I can make a lot of money. You have the respiratory system, you have this neurological system. Again, no one's talking about comprehensive care, right?
Nobody.
But you go see this dude for your headache, you go see this dude for your cry. It's ridiculous. So you have a system called the endocannabinoid system, and that regulates. That's like, hey man, I'm going to make your cardiovascular, your urinal, reproductive. I'm going to help it work in harmony. You feel me? And then I'm going to use these, when you take these herbs, and these are adaptogens. So, you know, adaptogens are great, like mushrooms and cannabis and CBD. Even they don't want to call it adaptogen. It's going to go to the parts of your body where you need it the most. So it's a fascinating plant because no other drug does that. You know, it's going to go specific, and then there's going to be side effects, you know. And then no other drug can brag like cannabis because there's 0 deaths associated.
0 deaths. Yeah, of course. I love bragging about
You
this.
either go sleep,
Zero.
When people come at me with the cannabis, I'll be like, we don't have any deaths.
Yeah, you might feel like if you took an edible and that's so because no one explained to you the science. Now, if you understand the science, you won't call 911 or cuss your friend out.
Exactly.
Yeah.
Exactly.
So how do you feel about edibles? Because I stopped smoking to do edibles because of the heart and the lungs and stuff like that.
Okay.
So do you think with me having a cardio issues and lung issues with the lupus, can I still smoke? Because I like to smoke, but I don't know if it'll like blacken my heart and do all
That's
that.
what I'm saying.
So I started eating
But
edibles.
we go back and forth. We go
Yeah.
back and forth every
Honey,
day.
them edibles had me right.
And I be like, no, bro, you need to smoke. They got you right. And then
It
yeah.
might take a little time, but them damn edibles, I be like, I be fucked up.
Well, inhalation is undefeated now because of its predictability. So, doctors, patients, when you buy something as a consumer, you want to make sure this chair is going to hold my weight and not collapse. You want to make sure it do what it do.
Yeah.
So when you inhale, you can safely and quickly inhale to effect. Because when you decarboxylate that cannabis, right, when you light it up and that THC is active, it's going to cross your blood-brain barrier really quickly. You know, when you inhale, within 1 minute, 1 to 3 minutes, it's crossing and coupling to your CB1 receptors. And you're starting to feel relaxed, and you're starting to feel cortisol go down, anandamide, and pain going down right away. But the half-life is only 3 or 4 hours. So people with chronic conditions like myself, I gotta burn all day, every day. Now I'm smelling loud. I gotta excuse myself. So now, as far as lungs, people are like, well, okay, asthma was the reason, and COPD was the main reason we wrote it in 1885 and 1890.
Oh, really?
Yes, because cannabis, if you have COPD, emphysema, bronchitis, asthma, coronavirus, it's COVID, SARS, right? It's when they're testing in mice, right? These mice are surviving that have THC. So cannabis is going to be open up your bronchioles. So you got these tubes in your lungs called like bronchioles, where the air goes through, right? So it's a bronchodilator, just like that asthma pump, and it's going to reduce inflammation. So asthma is bronchoconstriction, real tight, and inflammation. So we have written this as in the form of tinctures and hashish for asthma since the beginning, you know, in most civilizations. And you don't have to really smoke cannabis. There's a terpene called pinene. Say that word, pinene.
Pinene.
So pinene, like when you walk in the forest or you walk in the woods and you smell that pine smell, that's a natural terpene. That's a natural bronchodilator.
Wow.
So strains that are high in pinene are great for asthma, great for COPD. You'll be safe. Now, when you smoke, you're always going to create tar.
Okay.
The tar associated with cannabis, y'all FAQ me because I'm a smoker too. I inhale, you know what's called it. So when you inhale, it's going to create tar, but the tar associated with cannabis is not linked to cancer like it is the tar associated with cigarettes.
Also, that long they show for the long you smoke tobacco, it doesn't look as the same.
No, it's going to put tar on there,
Oh, it is.
but it's not causing cancer. Yeah, there's a lot of environmental pollutants that are going to cause scars and stuff on our tissue. Shit, when you clean your shower out, man, stuff is called, feel like my lungs on fire, whatever that crap is, right? So the tar associated with cannabis, again, is not linked to cancer. All smoking produces tar. You can vape as well. Vaping produces no tar. It's a battery heating it up. So you can inhale that way as well.
Yeah,
And that's inhalation. So vape. So yeah, definitely smoking. Inhalation is smoking or vaping. They both will be fine for you.
So, if I'm rolling a blunt,
Yeah.
not that I do. No, I'm just saying I do. But if I'm rolling a blunt, you know how you take a little piece out, you know, like.
That paper's terrible.
Yeah. Okay. So that's what I was about to ask. Doesn't it have tar and all that stuff?
Yeah, that has
okay.
way more. It has like rat poisoning, has addictive agents in it. It has chemicals in there to keep you coming back.
But
you
the
know?
I'm sorry, but the paper, the cones, they don't, right?
You know, there's some rolling papers. A study came out last week that some has some type of poisoning, heavy metal. So I don't like, no offense to raw.
Oh, okay.
There's better paper than raw though.
Okay.
So a lot of the pre-rolls, when you go buy them in dispensaries, the paper they're gonna use is raw vibes, or they're gonna use their palm leaves. You also see the palms. So most pre-rolls are stuffed with those types of paper. I like OCB papers out of France, very clean.
Okay.
I like OCB papers.
Where do you get those from? Because you can tell the people.
Amazon. I go to any head shop. Excel City got it. Always holds me down. So Excel City carries OCB. They have hemp. They got king size. But if you're using blunt paper, it's got a lot of nasty chemicals in there. So that's tobacco by itself isn't too bad. It could be good for you. It's a medicine, but it's what they add to it. And that's regulated like a regular commodity, like liquor. So be careful of stuff that's regulated and traded like a regular commodity. Liquor's over the counter. Motrin's over the counter. You take Motrin every day, it's going to kill you, cause ulcers. It's going to, goody powder lead, that's the number 16th killer in this country, and it's regulated over the counter. Alcohol, over 21, you can buy it, and you can have a credit card and fill your whole car up with it. You can get as much as you want, but you can't open it and drive.
Right.
Look at the regulation, look at all the death and all the domestic violence that's behind, directly contributed to alcohol. Look at the kids that are born, severely disabled, development delayed because of alcohol, not cannabis. Goody powder is terrible because it's uncoated aspirin. So it's aspirin. Now you have that, pills have a layer on it to protect your stomach. So by the time it gets to your stomach, the acid level, the pH level in your stomach is so high, it's going to eat that coating, and then it's going to be absorbed in your bloodstream, right? So goody powder is uncoated, it's old as hell, and it burns your lining. Now your stomach, your GI tract starts from your lips, it starts burning and causing ulcers, you know, and that causes sickness, sepsis, colitis, you know, leaky gut, death.
I was addicted to them.
Yeah, and cannabis is 20 times stronger than ibuprofen, Aleve, goody powder, Motrin. You understand? So 20 times stronger, doesn't hurt your kidneys, no deaths. And then you can say, well, what about steroids? Because she was talking about steroids. On steroids, cannabis is 2 times stronger than dexamethasone, prednisone. The oil's gonna do it. Okay. Both of y'all. And inhalation will do it. Inhalation will do it. Patches will do it. Gummies will do it. You know, suppositories will do it. Okay. So you try all the delivery methods you can, because everyone is different. You know, everyone's easiest. We all have one. Every mammal has one. With a vertebrae and without a vertebrae. You know, they're testing elephants for cannabis and stress and anxiety in the zoos. I mean,
it's the best thing ever, y'all.
Yeah, it is.
It really is. I just really stopped because of the fact of my lungs and stuff, and I wasn't educated.
Yeah.
So now that I'm here with you, I can see. And you know, your doctors are gonna tell you, your rheumatologist gonna say, no, don't smoke. You know, just
inhale. Only people I say do not smoke or inhale is if you're under 9 years of age. I believe your lungs don't develop until 9. So my caregivers, or if you're sick and you got patients or your kids under 9, don't smoke around them. That's secondhand smoking, you know, harm their lung development. But after 9,
really?
Oh yeah, after 9.
See, we getting some education around here, honey. We got a doctor
after
from
9,
Morehouse.
Yeah, from God. Yeah, so inhalation's fine after 9. You know, I have. And I'll do it again. I will say, hey, this is what, you know, try that, because they don't like the taste. It's easier, it crosses faster, you know, and they can handle it. They're not, you know, they're not bringing it to school. This is not rec. This is trying to save your life. For my sickle cell patients, for, you know, the one with childhood cancer. You know, you got kids that, you know, are born with Dravet syndrome, severe seizures, severe epilepsy. Yeah, you got to get off of those medications very fast. So there's patients as young as 3 months of age I've had, and you know, cannabis. Yes. 3 months. Wow. Yeah.
So tell us, I know that you go to the Capitol all the time with suits and stuff on. This is not how you look. He can get down there, yes. But he's down there. Yes. He's down there a lot. He's educating the people. He's you know. Tell us what you do.
Well, advocacy is huge. You know, we haven't gotten, you know, well, I'm on the tail end when I got in 2012, you know. We all know 1996, California was the first medical state. And before that, patients, even the recreational crowd, they've been self-medicating. But a lot of those pioneers are in prison or dead behind this thing. So it's only right that we kind of, you know, carry this torch on the finish line, because they did so much in the very beginning. So when I broke my neck in 2012, I was living in a state here in Georgia, y'all know, that was illegal, and I was a criminal. So, and I was getting it. It was helping me. So I'm like,
to all my Lupie Chix. Lupus matters, lupus matters. To all my Lupie Chix. Lupus matters, yeah. To all my Lupie Chix. Lupus matters,
lupus. And so you see us here, and you see us here. So we all.
Frame, boom, frame,
bam.
This one's a little crooked. You want me to bitch about it. You know, I want you to have the best. Okay. You know what I'm saying? Yeah.
Let's see.
Okay.
Yes.
That's it.
That's better.
Okay.
There you go.
That's what you have the best.
We gotta work together.
Okay, that's cool.
Like we family.
Like the champ out here.
Yeah.
That's how my Friday doing. That's how my Friday doing.
Nice. To all my Lupie Chix. If you know me, I'm a Lupie. I scream it loud. Advocating for the pure, we gon' move the crowd. support, we glad you came. We do it for our brothers and sisters, need the big change. We need a big fame, we need a big name. We need a research name, cause we all matter. We need a big fame, we need a big name. We need a research name, cause we all matter. All my Lupie Chix, Spanish, Spanish, Spanish. All my Lupie Chix, all my Lupie Chix, Spanish, Spanish, Spanish. All my Lupie Chix, all my Lupie Chix, Spanish, Spanish, Spanish. All my Lupie Chix. If you know me, I'm a Lupie, I will survive. Got the love from my people keeping me alive. And I be down, I get up, and I do not care. Some haters out there saying I give you that care. I eat the fat passes the stars from on high, baby. Especially on the days I'm thinking, well, why try, baby? Pain so deep I can't even cry, baby. The devil's trying to sell my soul on the platter, but I'm better. We need that big fame, we need a big name. We need that research name, cause we all matter. We need that big fame, we need a big name.